Dear friends, I am presenting a very short video on disease caused due to iron deficiency. I am Dr. P.R. Patel, retired professor and head, veterinary medicine. To view more videos like this on veterinary aspect, open the YouTube channel and type drvet drvet in search bar and then click search. You will get many such videos presented by me on YouTube channel. Here is the picture of YouTube channel is given. Iron deficiency causes anemia in almost all animals, but there is a special in piglets called piglet anemia. The etiologies are mostly newborn is affected due to lack of iron in milk. Milk is a poor source of iron, especially sow's milk is very poor. So piglets suffer from anemia, especially when the piglets are exclusively or intensively maintained on sow's milk, and when no other food is given, the piglets suffer from anemia. The normal fish stuff contain sufficient iron. Sometimes there is insufficient absorption of iron from the gut, and many cases are observed when there is continued blood loss caused by blood sucking parasites. The deposition of iron liver is very low and it will not last for a long time. Iron deficiency in sow's milk and it causes a disease piglet anemia. You know anemia is a disease where there is decreased hemoglobin and or RBC or both, and it is manifested by pallor of skin and mucous membrane. The piglet at birth have 9 to 11 gram% of hemoglobin, and there is physiological fall of hemoglobin on 8 to 10th day. So 8 to 10th day is very critical for this piglet anemia. If iron is sufficiently given, the hemoglobin returns to normal starting from 10th day. Otherwise, the piglet develop anemia and that is because of fast growth. So remember clinician, 10th day is very much important. The clinical manifestations are decreased food intake, sometimes there is diarrhea with normal color, severe dyspnea is observed, great respiratory stress, that is because of anemia, lethargy because of anemia, and increase in amplitude of apex beat when piglets on exercise. Clinically, it is diagnosed by skin and mucous membrane become pale and often yellow. That is because of anemia. There is edema of head and forequarters because of anemia, and if there is severe anemia, the young one die very quickly. And if timely iron is given, then there are chances of recovery also. Pathological changes, low hemoglobin content in piglets in first 10 days. This is a critical life of the piglet. Blood picture, there is decrease in RBC and hemoglobin at both. The clear and characteristic anemia observed is microcytic hypochronic anemia. Microcytic, the anemia, the RBCs are smaller in size. On postmortem examination, paler and thin watery blood is observed. Moderate anasarca, the liver is enlarged, mottled, and fatty infiltration. Diagnosis is provided by clinical examination. Examine the skin and mucous membrane. The paleness is observed. The blood shows decrease in hemoglobin and or RBC both. And on laboratory analysis of blood, there is a decreased iron level. Differential diagnosis, many diseases causing anemia are required to be differentiated. The anemia causing diseases are copper deficiency, hemolytic anemia, hemoglobinuria, protozoan disease, and many more. Treatment of iron deficiency, provide iron rich feed, give ferrous sulfate orally. Iron is unpalatable, so it is required to be mixed with feed or molasses and give as a liquid. For the dose, requested to refer a standard textbook of medicine and pharmacology. Parenteral injections containing ions are also available. Better to give hematinic mixture that contain iron, copper, and cobalt. Prevention in piglet, allow piglets to assess pasture along with milk. Don't raise piglet only on source milk. And oral dosing daily with iron preparation. The 10th day is very critical in the life of piglet. Thank you very much for observing video. Requested to forward this video to our fellow veterinarians. Thanks.